Hey y'all, this is Dr. Carmen Corder with thedoctornurse.com, and I want to walk you through the latest resources that have been added to thedoctornurse.com, which are the Pathopedia ebooks. I know a lot of you have probably seen me talking about the Pathopedia and, posting things on Instagram and Facebook about the Pathopedia and wondering what the heck is Pathopedia and how can Pathopedia help me as a nursing student. Well, I want to walk you through and show you exactly what I'm talking about with the Pathopedia and show you how this resource is going to be a tremendous help to you, not only when you are trying to do those nursing care plans that you all love for clinical, but it's also going to help you prepare for exams, because the Pathopedia are essentially everything you need to know about certain disease processes all in one spot. So let's just jump in and let me just walk you through one of my favorite Pathopedia and show you step by step what it contains and what you can expect all of the Pathopedia entries to contain, and show you how that these are going to help you with upcoming exams, with clinical paperwork, and just overall learning all these tough disease processes. So what we're starting off with here is one of the Pathopedia entries that is included in the CV Pathopedia ebook. And this is the Pathopedia for pericarditis. So you see that what you're getting is a chart, and it has 3 columns. And the first column over here has the step-by-step detailed pathophysiology of pericarditis. How pericarditis forms within the body, what is going on inside the body at the cellular level that leads to the development of pericarditis. Then the next column is the signs and symptoms that you're going to see as a result of the pathophysiological process that is taking place within the body. And then the final column are the priority assessments and the priority nursing interventions for pericarditis. So let's just look over here at the first column. So with pericarditis and with all of the Pathopedia entries, we start off talking about the etiologies and the risk factors. So etiologies and risk factors are what predispose a person to developing whatever disease process it is. In the case of pericarditis, these risk factors can either be of infectious origin or non-infectious. And I have all of those listed out here so that you can see the most common etiologies and risk factors for the development of pericarditis. Then in arrow form, I have described how these etiologies and risk factors lead to the initiation of the disease process within the body. So any of these risk factors, let's say it starts out as a viral illness, the Coxsackie virus, which is the most common viral cause. Well, any of that Coxsackie virus, as well as any of these other risk factors, be it an MI, rheumatoid arthritis, lupus, whatever, sets off the inflammatory cascade, right? So that causes inflammation of the pericardium, which then causes the neutrophils, which are kind of the first line of defense, to start flooding that pericardium. Well, what you're going to see on the outside of the body over here are the outward manifestations, which on the CBC, you'll see an increased white blood count, and you'll see a fever start to develop, because that's what happens when the inflammatory process is initiated. Eventually, with all those neutrophils, the pericardium becomes more vascular. So blood vessels actually start to grow within the pericardium and develop abnormally because of this massive inflammatory response. And what that leads to, always what the inflammatory process leads to, is the production of fluid, right? So that's what causes edema, when we get a cut. And in this case, it's the production of purulent fluid. Well, the outward manifestation of that fluid filling up the pericardium is going to cause muffled heart sounds, because you now have fluid in between your stethoscope and the heart sounds. So that is the outward sign and symptom of that. Eventually, you're going to get deposits of fibrin, because we know that with the initiation of massive inflammation, such as with pericarditis and such as with like DIC, for instance, the coagulation cascade also gets initiated. So you have deposits of fibrin. Those deposits of fibrin, which are clotting factors, lead to thick fibrous adhesions forming between those two layers of the pericardium and the epicardium. And this is where we're going to see the vast majority of our outward sign and symptoms, that classic pericardial friction rub, because those fibrous adhesions cause those two layers to kind of rub against each other to where they were nice and lubricated and they glided. Now they're rubbing, and you're going to hear a pericardial friction rub. Chest pain that worsens with lying down and improves with leaning forward. That is classic, and you'll see I have that in italics, because that is the classic sign of pericarditis. And it's the relief of that chest pain is simply due to the fact when the patient leans forward, the pressure is relieved off of the pericardium, off of those two layers. And so the chest pain eases when the patient is sitting up and leaning forward. The patient will experience dyspnea, especially when they're lying down. Chest pain on inspiration, because when the patient breathes in, those layers rub and grate against each other. And then ST elevation in all leads. When you have an MI, or when a patient has an MI, you'll see ST elevation in the leads that reflect the location of the MI, right? So like if the patient has an inferior MI, then you would see ST elevation in leads 2, 3, and AVF. But with pericarditis, you'll have ST elevation in all leads. And finally, this restricts diastolic filling, okay, because of all that fluid that is taking up space between the layers. That restricts the heart from filling like it should during diastole, and that eventually decreases cardiac output. And that's when you're going to see those scary signs and symptoms like the hypotension and tachycardia, which are signs of decreased cardiac output. Obviously, the complication of pericarditis, what we never want to see, cardiac tamponade and restrictive pericarditis, which those two complications leads to massive decreases in cardiac output. All right, so then over here in the final column, I have your priority assessments for patients with pericarditis. Obviously, we're assessing the ABCs, so we're starting with respiratory rate, quality, heart sounds, breath sounds, all your vital signs. Pulsus Paradoxus. Now, Pulsus Paradoxus is a very ominous sign because it is a sign of cardiac tamponade. So that's one of those things that you need to watch out for as the nurse, because you are always on the lookout for the development of complications, because there's always a Jason lurking in the background, right? It's not just pericarditis and, the patient's going to be okay. Anytime the patient develops a disease, there are other potential complications, just like a domino effect, that can occur as a result of the development of that disease. You will see an increased ESR, which is a erythrocyte sedimentation rate. That's a sign of inflammation, so you're going to need to monitor that as the nurse. You will be watching blood cultures, because we've got to figure out what bug is causing this so we can treat it. You'll be looking at the ECG. You'll be checking for those signs of decreased cardiac output, like the peripheral pulses. And obviously level of consciousness and mental status, because cerebral perfusion will be affected when cardiac output is affected. So those are all the assessments. So those are the things you're going to be monitoring and watching for, the labs that you're going to be drawing and monitoring. And then the interventions, what are we going to do about it? Well, we're going to address ABCs first, right? So we're going to position the patient upright. This is how they breathe the best. We're going to give oxygen. We're going to treat the pain because the pain is going to interfere with their ability to oxygenate and perfuse. We're going to give steroids because we've got to stop that inflammatory process in its track. NSAIDs, indomethacin, is especially helpful with patients with pericarditis. Inotropic drugs like Wtrex or Wbutamine to help increase cardiac output. And now colchicine, that's kind of unique, but it really reduces inflammation in patients with pericarditis. So you will see colchicine ordered. And then also antibiotics or other anti-infectives to treat the underlying cause. And so that is your first page of your Pathopedia, and this is what it looks like for every Pathopedia entry. I'm just using pericarditis as an example. And then the next page, for many of the disease processes, I have several key points listed. Stuff that you need to know, absolutely need to know about each of these disease processes. All right? So that is the Pathopedia in a nutshell. Check it out. Head to thedoctornurse.com. If you're watching this video from somewhere other than thedoctornurse.com, click on Pathopedia. What is up there already are the CV, respiratory, and GIGU Pathopedia ebooks. Get yours today. I promise you, you will not be disappointed. This is going to help you cut down the time that you're spending on clinical paperwork, and it's going to help you study for understanding of these disease processes and why you're seeing the signs and symptoms that you're seeing, and then to help you understand what you're going to do about it. So thanks so much for watching, and I look forward to hearing from you guys real soon and hearing how much these Pathopedia helped you in your nursing courses.